Question 1. Which two factors determine first aid facility needs on site? A. Equipment cost. B. Hazards and risks of work. C. Number of workers on site. D. Time to buy equipment. Answer B and C. Hazards and risks of work and number of workers on site. Question 2. What does an appointed person do for first aid on site? A. Provide most first aid care. B. Provide all first aid care. C. Contact emergency services. D. Apply splints to broken bones. Answer C. Contact emergency services. Question 3. What does proactive monitoring of health and safety involve? A. Ensuring staff follow instructions. B. Preventing repeat accidents. C. Assessing risks and safe methods. D. Checking staff read safety notices. Answer C. Assessing risks and safe methods. Question 4. Why are young workers more at risk of accidents? A. Legislation does not apply to them. B. They often work alone. C. They lack experience and hazard awareness. D. No duty to provide protective equipment. Answer C. They lack experience and hazard awareness. Question 5. How should liquefied petroleum gas cylinders be stored on site? A. In a locked cellar with signs. B. In a locked compound 3 meters from oxygen cylinders. C. In a secure container. D. Covered with tarpaulin. Answer B. In a locked compound 3 meters from oxygen cylinders. Question 6. Where should liquefied petroleum gas cylinders be placed when supplying a site cabin? A. In a locked cupboard inside. B. Under the cabin. C. Inside next to the appliance. D. Outside the cabin. Answer D. Outside the cabin. Question 7. What protects passers-by from arc eye during welding? A. Warning signs. B. Screens. C. Personal protective equipment. D. Nothing. Answer B. Screens. Question 8. What is the minimum spillage bund capacity for a fuel storage tank? A. 110% of tank contents. B. 130% of tank contents. C. 150% of tank contents. D. 175% of tank contents. Answer A. 110% of tank contents. Question 9. When must a fatal accident or dangerous occurrence be reported to the Health and Safety Executive? A. Immediately. B. Within 5 days. C. Within 7 days. D. Within 10 days. Answer A. Immediately. Question 10. What happens if a prohibition notice is issued by an inspector? A. Work continues with risk assessment. B. Work subject to notice must stop. C. Work continues with extra precautions. D. Current work finishes but no new work starts. Answer B. Work subject to notice must stop. Question 11. Who should be informed if a worker reports work-related hand-on vibration syndrome? A. Health and Safety Executive. B. Local health authority. C. Workers' doctor. D. The nearest hospital. Answer A. Health and Safety Executive. Question 12. When must an employer prepare a written health and safety policy? A. Employing 5 or more people. B. Employing 3 or more people. C. Employing a safety officer. D. Work lasting over 30 days. Answer A. Employing 5 or more people. Question 13. When must significant risk assessment findings be recorded? A. Employing 3 or more. B. Employing 5 or more. C. Employing 6 or more. D. Employing 7 or more. Answer B. Employing 5 or more. Question 14. What confirms a safe lifting operation sequence? A. Crane hire contract. B. Approved lifting plan or method statement. C. Lifting operation toolbox talk. D. Risk assessment. Answer B. Approved lifting plan or method statement. Question 15. What does the lower exposure action value mean for noise? A. Average background noise. B. Level where workers can request hearing protection. C. Maximum noise at site boundary. D. Level requiring mandatory hearing protection. Answer B. Level where workers can request hearing protection. Question 16. At what noise level must hearing protection zones be established? A. 80 decibels. B. 85 decibels. C. 90 decibels. D. 95 decibels. Answer B. 85 decibels. Question 17. At what noise level must hearing protection be provided if requested? A. 80 decibels. B. 85 decibels. C. 87 decibels. D. 90 decibels. Answer A. 80 decibels. Question 18. What does a daily noise exposure of 87 decibels signify? A. Lower action value, no action needed. B. Upper action value requiring protection. C. Peak pressure stopping work. D. Exposure limit not to be exceeded. Answer D. Exposure limit not to be exceeded. Question 19. How should personal protective equipment be considered in risk control? A. First line of defense. B. Only practical measure. C. Best way to tackle the job. D. As a last resort. Answer D. As a last resort. Question 20. What should be considered first after a risk assessment identifies a risk? A. Ensure protective equipment availability. B. Adapt work to the individual. C. Protect the whole workforce. D. Avoid the risk entirely. Answer D. Avoid the risk entirely. Question 21. Why is identifying hazards important? A. They could cause injury or damage. B. They must be eliminated before work starts. C. They must be reported to regulators. D. They require toolbox talks. Answer A. They could cause injury or damage. Question 22. What does risk mean in a risk assessment? A. Potential to cause injury. B. Unsafe act or condition. C. Likelihood a hazard causes harm. D. Any dangerous work activity. Answer C. Likelihood a hazard causes harm. Question 23. What must a subcontractor provide for a 17-year-old worker? A. A mentor at all times. B. Regulator permission to work. C. Legal guardian consent. D. Risk assessment for young persons. Answer D. Risk assessment for young persons. Question 24. Where must the number of people allowed in a passenger hoist be displayed? A. On a notice in the welfare area. B. On a notice in the hoist cage. C. During site induction. D. To the hoist operator. Answer B. On a notice in the hoist cage. Question 25. What should be the first safety consideration for site access points? A. Parking for cars and vans. B. Access for emergency services. C. Access for heavy vehicles. D. Site security. Answer B. Access for emergency services.